The good news is you're all masters of your own health destiny, and that's what you continue to take care of. The bad news is the body undergoes a change from health towards disease processes, and that's where there's a requirement of awareness, a deep-seated awareness, and also an action which should be timely. Friends, are you aware that at this point in time, the brain, a vital organ up there, and bladder, an organ in a supporting room down there, are in a deep silent conversation all the time about the next 3 hours of our social life? Whether the brain will win by making the bladder contract and make you rush to the washroom, or the bladder would win by relaxing and expanding and stretching, which it is capable of as the best actor in the supporting room down in the pelvis, needs to be seen as you move forward. Is bladder our unsung hero in the pelvis is what we need to know. Bladder as such is an organ which is a hollow viscous organ deep in the pelvis for all of us, such a mature organ. An organ which actually stores urine running from the kidneys every minute and therefore stores silently, relaxes, and then goes on to contract when you go to the washroom. This entire episode of relaxing and contracting is something which the bladder continues to do as an automated organ, a computerized organ all the time. It is important for us to therefore understand that, like we have various organs which work with contraction and relaxation, like the heart which contracts 72 times per minute. If it doesn't contract for a minute, we are not there. The bladder actually relaxes and contracts around. So if you look at it, the bladder relaxes for 23 minutes and 57 seconds every day in spurts to keep you 2 hours, 3 hours, and 4 hours in relaxation mode. Therefore, it's storing urine at that point in time. And then for 3 minutes out of 24 hours, in spurts of 30, 50, and 60 seconds, you are in the washroom where the bladder contracts and empties urine. And that is the emptying phase. So imagine a computerized organ as good as that, which actually works in unison and gives us that social life where we can hold urine out. Friends, like we have got our own brain senses, those 6 senses. In health, bladder has got those 6 intricate capacities, which makes it very capable organ. Let's look at those capabilities which actually matter. Number 1, it actually serves as a very unique social architect. It allows us to actually hold urine till we reach to a social place where we can pass urine. It stabilizes completely an adequate balance with brain, and therefore the rhythm between the brain and the bladder is one of the biggest rhythms that you actually have. It coordinates with the outlet and allows us to empty when we are ready to empty the urine. It maintains a very silent, unparalleled health record. I wish that happens for everybody in the world where bladder does not get diseased. Friends, it also behaves like a balloon which is filling up for all of us in this audience and buys us that extra freedom which is required for us to hold urine out. And isn't it the bandmaster, therefore, of the entire orchestra or of a social life? When I look into this, I understand that this could be perhaps the bandmaster of the entire orchestra and our hidden hero deep in the pelvis, which works incessantly 24/7 and gives us that social life. But sadly, this may not be everybody's story. Health changes dramatically in individuals, and there could be individuals who could be at crossroads of their life because of bladder changes happening as diseases. So from young age group of 16 to an elderly gentleman at the age of 76, let's piece it accordingly and look into what happens to these individuals who go through this situation of not able to be maintaining their bladder health. What does bladder health mean for them is important. Friends, magic is something you make every day. The magic that we make every day needs to be translated into the continued awareness which is required, and from there the timely action which is required for all of us. And therefore, awareness on one side and action on the other side has to be very composite and very timely. Let's look into all these 5 individuals who go through it. At the age of 16, 6 nights a week, leaks urine in the bed in deep sleep. In the daytime, he's absolutely perfect. He continues to be as cheerful in the daytime as he could be. But the night times are all about leaking urine in the bed. He's very scared of going to the hostel next month as a sophomore because he's leaking urine almost every night. He's suffering from what is called as bedwetting or enuresis. He dreams of that dry nights and good mornings, which actually is not coming to him, but he's going through it. We move forward and look at a lady in the prime of life, she is 26. At the age of 26 in prime of life, she passes urine 14 to 16 times a day. That's increased frequency compared to 6 to 8 times a day. And that's emanating because the bladder gives us an urgency. Contraction of the bladder is excessive and not in the normal contraction relaxation. Sometimes she leaks urine before she reaches the toilet. So she has increased frequency, urgency, and urge incontinence, and she's adapting to it. She looks for toilets in the vicinity wherever she goes in around. She has a progressive disease situation, and she's being treated, which actually is failing. That's a sad story. And therefore, she has relegated herself to a situation where she continues to live with it. Wears diapers, drinks less water, searches for the washroom wherever she could go in. She is suffering from overactive bladder. The bladder is different from bladder in health with relaxation and contraction, giving a social architecture. She is living in agony. She is living in a situation which is all about passing urine, running to toilets, leaking urine day in and night, and a bladder does not fill up like this. Her bladder empties before the bladder could actually empty. Let's move forward 3 decades later to somebody who's going through a very progressive and unrelenting disease. Our bladders don't pain when the bladder fills up. It fills for 2 hours, 3 hours, 4 hours. This lady and many ladies in the world go through this situation where when the bladder fills up, there's a pain, there's a displeasure, there's a discomfort, and there's a pain on bladder filling. She has to go and rush to the washroom more frequently because the inner lining of the bladder is going through disease, as a result of which she has to pass urine more frequently. She's not having overactive bladder. She has got a situation where the bladder is contracting erratically. And this is a downhill course. She sees that it goes year by year, and she is sadly suffering with interstitial cystitis bladder pain syndrome. She calls this as fire in the bladder. The bladder is on fire. This burning sensation, discomfort all the time, and it comes erratically for few hours, many hours, not related to urination, because urination is provoked because of that. When we look into somebody a decade later, he's 66. And at the age of 66, friends, he has lost his bladder sensations completely. There are no bladder sensations at all. And this is unfortunately a result of decades of uncontrolled, long-standing diabetes. India is becoming a diabetes capital of the world soon. And sadly, this could be for many people whose bladder will gradually lose sensations and therefore does not feel this large capacity bladder. The bladder is too full. Does not contract to empty the bladder. So sadly, his friend actually is a urinary pipe or a catheter, which he has to be on all his life. And that is what is called as underactive bladder. Imagine these kind of scenarios are commonplace. These are not uncommon. He lives this life all the time. So there are changing bladder scenarios happening from young age to elderly people. And this goes on very silent. People suffer in silence, in agony, in anguish, and they probably cannot speak up all the time. Unfortunately, therefore, many of them are underreported, understudied, under-evaluated, underdiagnosed, and sadly undertreated. So a lot of world which goes through this crossroads of bladder going through this health actually goes through the suffering of underreported, undertreated bladder disease as compared to the health that you and I have, which is what the aim is today, to bring health to the front row seat. So from a very wonderful computerized organ, a hollow muscular organ, an adult bladder, which can hold urine for 2, 3, 4 hours, a 300 to 500 ml of bladder, and they would go to the washroom and empty urine. From that specialized, sophisticated biomedical marvel, things have changed for these patients around. They have gone through a situation from sustained elasticity to incapability. The coordination is gone. Discomfort rules their life. They look forward to doctors who could help them out. And if that is what is the situation, it does not happen of a common receiving, storing, and emptying urine. Friends, this is what happens to many who from this have moved on to a present state of bladder unwellness. If I look into this, it's a job of a doctor, a job of a urologist, and a job of an entire society to bring about care, to bring about a cure, to make this impossible. These people go through day after day, year after year, and decade after decade to a situation which could make them possible. So impossible to possible, finally treatable and curable is possible. It's about to prevent, it's about to treat early and identify early, but it's important also to wake up to this phenomenon. When I look into this, I understand that bedwetting is treatable and curable. This child should be treated before adolescence. 6 to 15-year-old children bedwetting at night should be treated in time, otherwise they'll become adults and they would not be able to manage this. These are situations of milestone disorders. The child continues to leak. Society and parents may not be aware of it. And what we need to do is bring about that medication which will improve the bladder and the brain rhythm. And that's all. The bladder will be silent at night like it happens to most of us. This is important. When we wake up to this phenomena, we're looking at overactive bladder, the woman on diapers. So is India living with incontinence and diapers, or are we ready to live in incontinence and diapers? Friends, this is more common in women. As women suffer, we need to look at stepwise approach. While we educate them, we educate the bladder. We tell them how to pass urine, how to hold urine, how to do timely warding, how to search toilets. And that's only a behavioral therapy. There's a pharmacotherapy which is involved in urology, where we start medications that dampen these excessive bladder contractions. The bladder then becomes a friend instead of an enemy, making you run again and again. A very important aspect of this. Failing which, we move up the ladder algorithmically to give botulinum toxin in the bladder and silence the bladder. Failing which, if it becomes refractory, we do sacral neuromodulation, a situation where we place a battery in the pelvis and the whole thing is modulated. So this is a treatment which is available. Bladder pain syndrome, bladder filling up, giving me discomfort, pain, and living a life of agony is all about treatment. Again, this is more common in women than men. And when this happens, it is about improving the internal lining of the bladder. The lining can be improved. Let's not treat it wrongly like a urinary tract infection. And when we do this, we preserve the bladder, we give her life, we give her support. She's not having burning pain and fire in her bladder anymore. So preservation of bladder is important. When you look at underactive bladder, sadly, that's a situation of irreversibility in which from injury, from spinal issues, from neurological issues, and from long-standing diabetes we discuss, the bladder goes to a situation where no sensations, no contraction, and the only friend is a catheter or long-term tube all his life. But friends, there is this light at the end of the tunnel, which is called sacral neuromodulation, where a battery or a pacemaker in the pelvis can bring about reversibility in sensations, in contraction, and the bladder is probably back to its life, no catheters, and leads a better life. Sacral neuromodulation. So when you look into all these aspects around, understand all these 4 patients, 16, 26, 56, and 66, were actually patients of bladder diseases, which could happen to close to 400 million people across the world who suffer in silence, agony, attempted treatments, and probably also succeed in cure. But let's look into a situation at 76. The bladder was not at fault. The bladder of friendly champion in the pelvis was not at fault at all. What happened? This bladder got its sensation completely lost. Long-acting continued obstruction to the urinary flow. The door was getting closed gradually, and the bladder was compensating. And what happens? In men from 40s to 60s onwards, something starts where a hormone-related change brings about a prostate enlargement. And when this happens, a lot of people land up with this. So what happened was a bladder which turned weak out of compensation to a decompensation. Let's go deep into it. Progressive prostate changes happen in men. And that change in the prostate causing obstruction as a result of the prostate growth brings about a compensation to the bladder, and the bladder compensates. It compensates and contracts more and more. And later on, how long will it contract? Decade after decade, it's failing. As a result of a small prostate growing into a large prostate, the bladder can actually fail because of decades of obstruction. So friends, here, the bladder did not fail on its own. The bladder didn't have disease. It is only for the want of a nail, a battle was lost. And stitch in time could save 9, which means that if we could treat prostates early for all men, we could actually save the bladder. And that's a program, that's a huge kind of a passion to purpose I had over 25 years of urology, deep into the subject of bladder, deep into the research of the bladder in both clinical work and research, that I launched this important Save the Bladder project, which I keep it very close to my heart and sing it all the time. I look forward to all men in 40s, 60s, and 80s who could treat their prostates early so that the bladder doesn't get decompensated. So friends, they always say, I love my urologist. But it's not the urologist who is the hero. The hero is the organ of balance, my champion in the pelvis who actually takes care of all of us, including you. Awareness to action, therefore, is required. This organ is a director of all the issues in the pelvis. This organ is a bandmaster of entire orchestra, happens to be a conductor of smoothness that we have between relaxations and contractions. And when I look into this, this is the maestro and a magician. This is a savior of our social health. It truly is a hero, a champion, and probably my actor in the best supporting role who should get the prize. So when I look into this, it's time for all of us in the world to identify our bladder about whom we never thought about. We think about brain, heart, lungs, kidneys, liver, because we know they are vital organs. But the best supporting actor needs to be embraced. It's time to join hands with the best supporting actor, support the bladder, look at your health, probably don't miss out your health. And as I look into this for our freedom tomorrow, it is important to save the bladder today, because every life matters, every quality of life matters. It is therefore imperative that we truly understand bladder is the unsung hidden hero deep in the pelvis about which we had never known. And if we never knew, probably would never have taken action. Friends, मेरा भारत महान, मेरा body महान और मेरी bladder महान. Thank you very much.